There's day 7. Okay. These lesions are full thickness. So when they heal by scarring. And this just shows the timeline. And basically the incubation period is somewhere in the neighborhood of a week to about 12 days. Then you're sick with the flu-like syndrome. Then you get the rash. And the total time period, roughly 3 to 4 weeks of illness. Here's the minor form of the disease. You see she's still got the pox. Well, what do you notice about her? She's not sick. She's not incapacitated. She's up and about doing her daily business, spreading the disease. Okay? This is the minor form. This is the flat type. You notice that the bumps are nowhere near as pronounced as they are in the major type. Okay? Hemorrhagic smallpox. Fortunately, only a small percentage of patients get this, but they get a coagulopathy. They bleed into these lesions. These people do not do well. Okay? So how are we going to make the diagnosis? The clinical presentation, that rash. Okay? That's what we're looking for. We can do all sorts of fancy stuff, electron microscopes, PCR assays, tissue culture. Okay? Days before you get that back. Clinical diagnosis. Treatment's primarily supportive. We have antiviral agents. Will they work against smallpox? Darned if I know. We don't have any cases to find out. Okay? So we're going to learn the hard way, when and if we ever have our first case. Okay? There is a vaccine that's available, and that is something that when and if we have our first case, I think we're going to see the entire population of the U.S. immunized. Until then, probably not. Okay? Here's chickenpox versus smallpox. Okay? Incubation period for chickenpox, a lot longer. Notice the difference in distribution. Smallpox, arms and legs and face. Chickenpox, chest. Okay? Any of your kids had chickenpox? Hopefully you all had them vaccinated. But if you did, in the good olden days, what did parents look for? Check the chest. See what the chest looked like. That's what they look for. Okay? And then the rash is all the same in smallpox, and in chickenpox you have new lesions, old lesions, etc. Okay? There's the distribution. Smallpox versus chickenpox. So if you look at this picture, 1 asterisk means which disease? Chickenpox. 2 asterisks is clearly smallpox. Okay. There's chickenpox. You can see new lesions, old lesions, small lesions, big lesions. Okay. All different ages. The vaccine. If you were exposed to a patient, we have about 3 to 4 days that we can vaccinate you. And it will decrease the likelihood that you will get the disease. It's not 100%. Okay. So you can get the vaccine, you can still get smallpox, but it does reduce the incidence. But we also know that the Russians tried to create a version of smallpox that had a much shorter incubation period so that vaccines would not have an opportunity to work. Okay? So lots of bad stuff out there. We have enough vaccine to immunize the entire population. Okay? Contacts. If you are contacting a patient with smallpox, we're going to quarantine you for 2.5 weeks. Think about quarantine in this country for 2.5 weeks. We haven't done it in decades. Okay? You can tell people they can't go to work. You can tell them they can't go shop for food. How are we going to supply them with food? Huge public health nightmare. Okay? But smallpox, the virus, we still have some, and one of these days it may get out. Okay? If we have lots of patients, we'll cohort them on the same floor in the hospital, in the same hospital. The health department, when they got concerned about this about 15 years ago, wanted to declare smallpox hospitals. Okay, you can guess how many volunteers they had for that. Okay, problem. One case, this is an actual case, 1963. Sailor traveling from Australia to Sweden, multiple stops along the way. Okay, he developed a fever and rash, diagnosed with smallpox. he actually infected 19 people, and more than 300,000 people worldwide had to get vaccinated from this one case. Okay. Monkeypox also exists. Monkeypox typically infects monkeys, but it can be spread to humans. Okay. And human to human spread is possible. It looks like smallpox, but it's a much milder disease. This kid in this photograph, okay, has monkeypox. You can see he's not prostrate. He's actually not looking too bad other than he's unhappy, okay? It's not a totally benign disease. You can see the fatality rate up to 10%. If you are protected against smallpox, you're protected against monkeypox. If you're not protected, obviously that's a problem. In 2003, there was a thought that maybe those poor prairie dogs once again got blamed for a case of monkeypox, but it never went anywhere. So, problem. I will mention there is now another outbreak of monkeypox happening in Africa. Okay, so again, if you were to respond to an airport for someone who was sick, had these pox-like lesions, you would definitely want to get a travel history and find out, because there is an outbreak of monkeypox going on right now in Africa. Viral hemorrhagic fevers: Ebola, Marburg, Congo Crimean hemorrhagic fever, Lassa, dengue, yellow fever. These are all virus diseases. They all have something in common. They cause fever and they attack the vascular system, our blood vessels, okay? Spreads by insect bites or contact with infected fluids. The photograph of that arm, that's Congo Crimean hemorrhagic fever. You can see the entire arm. Basically, that patient is bled into that arm, okay, as a result of that infection. Okay. You should be aware there is an outbreak of dengue, I think in Brazil going on right now, and some cases of yellow fever in one of the countries in South America. Don't remember which one. So once again, fever, myalgias, okay, you feel like garbage. Then, when the vascular bed, when your blood vessels get targeted, you start bleeding from all of your mucous membranes, the eyes, the gums, everywhere, okay? Bleed enough into shock, damage the kidneys, damage the liver, okay? If you get renal failure or liver failure, obviously those people die. Mortality varies depending on which of the hemorrhagic fevers you have. Ebola averages about 50 to 80%, okay? Treatment, totally supportive for almost all of these. Fluid resuscitation, transfusion if you need it, okay? We now have an Ebola vaccine that seems to be quite effective. It was tested during 2015 in a trial and is very promising. So there's some good news on that front. The other diseases we don't have a vaccine for. If there was an Ebola outbreak or any of them, okay, you want to minimize the number of people exposed. So please don't send police, fire, and EMS to these calls. You're just going to send EMS. Minimize the number of responders. Strict barrier precautions, okay? Maximize the airflow through the ambulance, open the windows, etc. Crank the fan up to high, okay? Everything has to be disinfected. Body fluids, equipments, everything has to be disinfected. The photograph at the top, that's a patient with Ebola in Africa. And you can see, if you look carefully, she is bleeding from her mouth. Her gums are bleeding, okay? The picture below that is a Congo Crimean hemorrhagic fever patient, okay? And you can see all the hemorrhages in the skin of this patient. If you get exposed, intact skin, scrub it for 15 minutes or more with a detergent solution, okay? Or some sort of germicidal solution. If you have an open wound, irrigate the hell out of it for a half hour at least. If it's a mucous membrane, irrigate it really well. This is a summary slide. And by the way, hantavirus here in Colorado, okay, mice, okay, hantavirus is one of these viruses, hemorrhagic virus, okay. It tends to affect the lungs more than some of the others, but you can see Ebola and Marburg, major organ necrosis. Lassa and Machupo, oropharyngeal lesions. Congo fever, severe bleeding. Yellow fever, dengue, Rift Valley fever. Jaundice syndromes, meaning it damages the liver, okay? All of them have a rapid progression to shock and death. Okay, so this was a case study about, 20 years ago. A lab worker in Zaire developed fever and bloody diarrhea, was diagnosed with Ebola. By 5 weeks later, there were 93 cases, 92% died, most of them in healthcare providers taking care of this patient. 5 weeks after that, we were up to 300 cases. Okay. Why? Because they had terrible precautions. World Health and CDC went in, instituted barrier precautions, finally stopped this from spreading. Okay. We've had a number of outbreaks since then. Okay. Almost every 3 to 4 years. Okay. The worst one being this last one in 2013, 2014 in Western Africa involving 5 countries, 30,000 cases, 11,000 deaths, 41% mortality rate. Okay. Lots of reasons why it didn't go well. I'm not going to belabor it in this talk. Okay. But bad news disease. The feds published a document that gave guidelines for how to manage these patients, both for dispatch and for EMS personnel. It's a great document, ought to be looked at, okay? So, toxins, the fun stuff. Toxins, these are naturally produced poisons. They are more toxic than anything we make. It's amazing how don't screw with Mother Nature, okay? When she gets angry, this is what we get, okay? The good news about these is they don't get absorbed through intact skin with one